Welcome, everyone. We will get started in just a few seconds here, letting a few others join. Okay, we'll go ahead and get started. Welcome to Understanding and Participating in NCQA Public Comment. Thank you all for taking the time to join us today. So before we begin and meet today's speaker, a few quick housekeeping notes to go over with you. Thank you. So during this webinar, we do want you to be engaged. So please locate the Q&A icon on the menu bar and submit your questions that way. We will do our best to answer some of these questions live at the end of the webinar and also in the chat feature during the webinar. Anything that remains unanswered, we will get back to you within the next 5 to 7 business days. And also by the end of this week, expect a recording of this webinar as well. And in addition to our speaker, we also have a panel of experts on this webinar who will be answering questions behind the scenes to help out as well. Now let's meet today's speaker. So back up, just there we are. So today's speaker is Sveta Polhemus. Sveta is, as you can see, our Assistant Vice President of Evaluation Programs here at NCQA, which is part of our product management function. Sveta has over 15 years industry experience, including her dedicated work with us here at NCQA and also previously working in the private sector consulting with CMS. In addition to her impressive bios you can see on the screen, she also holds a Master's of Public Policy from the University of Maryland. And without further ado, Sveta, I'm turning this over to you to get started.
Thank you so much, Kim, and welcome everyone. Good morning to some of you. Good afternoon to those of you on the East Coast. We're absolutely delighted that you have chosen to spend the next 45 minutes with us. We will take you on a brief journey on the themes in our public comment, the programs, how they interact with each other, an expectation around the timeline of when you can anticipate seeing these final standards updates live in our system, in our publications. We'll also talk about how to participate. If you're new, we cannot hear the speaker. Okay, that is a challenge. I wonder if somebody can let me know if this is for everyone.
I can hear you. Okay.
Okay, it appears that maybe a technical difficulty for a handful, but hopefully you can listen to this after we've concluded. We'll talk about how to participate. Do not be afraid. It is not very difficult, and we hope you choose to give us your feedback. And of course, we'll reserve about 10 to 15 minutes for live Q&A. So keep your questions coming, and we will get to them in just a little bit. Okay, so what is up for public comment? There are several programs. There are 5 programs available for this year's public comment. And we have one topic that is program agnostic. So we have Health Plan Accreditation 26, Utilization Management Accreditation, Managed Behavioral Healthcare Organization Accreditation, Long-Term Services and Supports Distinction, which is part of our Health Plan Accreditation program, and then our PCMH, Patient-Centered Medical Home Recognition. The artificial intelligence feedback set of questions is, like I said, program agnostic, and we'll tell you a little bit more about that as we advance in the next sections. Now, many of you might be veterans of NCQA public comment, and we appreciate you always taking the time to gather the feedback and give us important facts about how your organization operates, what may be challenging, what may be a better way of updating our standards. We really appreciate it, and we hope you continue to do the same. For those who are new to NCQA public comment, and even if you're returning, we want you to know that we read every single comment. This is really important for us, and it does help highlight what might be missing, how NCQA should consider different ways of doing something. Therefore, the more detailed your feedback is with specific examples, that would really go a long way in helping implement standards updates that align with the intent of what NCQA is trying to accomplish. And keep in mind that the updates always put the patient first. We know each one of us is a patient somewhere. We have a family member who's a patient. We ourselves might be patients. So our driving force behind the updates is always the patient. And of course, we have to take into account how these updates will be implemented and what it will take on behalf of each organization to actually carry out the quality improvement updates that we have provided for you. Now, I wanted to take a moment to illustrate how your feedback from last year's feedback on our credentialing updates really made a difference, right? We don't always, NCQA does not always change the final recommendations, but when we do receive feedback that there are challenges that are outside of some organizations' ability to change and influence. In this case, we recommended that health plans and organizations that pursue credentialing accreditation have 90 days. They work with data that's 90 days old at time of credentialing decision. We heard loud and clear during public comment that there are a lot of challenges related to obtaining that data in that period of time across all of the credentials that we have listed here. And so based on the feedback, we at this time for standards year 2025, we went with the recommendation that was made and of course approved by our committees of 120 days from 90 days. We also want you to know that we use the data that is in our survey tools that's submitted. In this case, we did look at how organizations were performing in general. So we are relying on data that we have in our systems to make recommendations because we have a very robust set of data that's available from many years of surveys. And something happened. I apologize. I think we're back. Great. There's always a technical difficulty somewhere. In addition to the public comment period, which lasts a month, NCQA is also holding an NCQA states webinar. Many of the states rely on NCQA standards and guidelines as part of their quality improvement efforts. And for this reason, we want to update them on the updates. They also participate in our public comment system feedback. We are also doing industry groups feedback. If there's an industry group that you would like us to speak with, please let us know, and we would be happy to present during our public comment period and obtain more specific feedback. And of course, NCQA has committees. We are the National Committee for Quality Assurance. And our committees that approve the standards updates consist of different healthcare segments and patient voices. We have state, federal, employer, health plan, health system, and industry group representation, and they review the feedback that you provide along with the final recommendations before everything goes to our board of directors. Now, let's get to what you will be noticing and what you will be seeing in our public comments. As you're reading, if you choose to read all of the public comment materials across all programs, there are some themes that you will notice that are highlighted here on this slide. Some of the updates are found in multiple programs because we want to enable industry and organizational alignment, as patients are often taken care of by multiple organizations. The health plan, the provider themselves, a vendor who might be taking care of some of the prior authorization decisions and so forth. So you will see a lot of data sharing, expectations, and requirements. We do want to enhance the exchange of data and expectations between payers and providers, for example. Behavioral health, no wonder, and hopefully not to anyone's surprise, is an area that is very important to NCQA and to patients across the country. So you will see requirements and more specifications about how to measure access to behavioral health. There's payer-provider engagement and collaboration expectations that we have outlined, and we really look forward to your specific feedback there on how to enhance that collaboration. And prior authorization and the experience with prior authorization and the process in general are important component of any patient's journey. And the updates that we're proposing really seek to help organizations improve that experience. Now, in the following slides, I will highlight what you might see, what you will be able to see in each of the program updates. But note that I am doing a very, very high-level overview, which cannot be replaced by the detailed information that we have provided on the public comment website. And this is intended to pique your interest and hopefully engage you in providing detailed feedback. So for health plan accreditation, this is our largest program. We have over 1,200 lines of business between commercial, Medicare, Medicaid, and exchange pursuing health plan accreditation. There are over 180 million American lives covered by health plans that pursue NCQA's health plan accreditation. Given the size of scope and reach of this program, we're really hopeful that the updates that we're offering here help the health plans further the efforts that many of you have already undertaken. We know that health plans work in a very dynamic payment and policy environment. We know that change is constant in this space, and the updates that we have chosen to share with you this year hopefully align and further your efforts and give you a glide path to achieving what some of you may have started or getting started in areas like data exchange and usability. Because that is what is required and needed for care coordination and better patient outcomes. You will notice in our population health management program standards, there's more emphasis on payer and practitioner collaboration and engagement. A lot of the standards are updated. There may be some clarifications and enhance expectations in the explanation. So we encourage you to read the standards updates. Everything that is new is underlined to make it easier for you to highlight and to follow what has changed. For the utilization management and prior authorization updates, the biggest change there you will see is around data collection, analysis, and taking action on the findings from your analysis. I want to highlight here that the intent of the data collection for is not to compare yourself to other health plans or for NCQA to compare you to other organizations or to set benchmarks. The intent here is to focus on internal specific line of business for Medicaid, for example. As you're looking at data longitudinally, you should be able to see differences and changes and perhaps some spikes. And that's what will allow you to see as an organization opportunities to focus in on some areas that are perhaps causing friction for your members or practitioners as they're experiencing the prior authorization or just in general, the process. For behavioral health network adequacy, we know this is challenging for many organizations and particularly for patients who often lack access to needed care. The proposed standards really aim to add more specificity about how to measure, about the provider types that are counted. And we, again, look forward to your feedback there because the outcomes for patients in this space need improvement, and access is the first step in that path. Okay. For the next program I want to highlight here is Utilization Management Accreditation. And I see that we jumped to MBHO. Here we are with Accreditation 26. We're aligning all programs. So the things that I mentioned regarding utilization management and health plan accreditation, those same type of updates you will see in the accreditation program. You will also notice if you're a customer of this program or if you're a health plan that's delegating to a accredited entity, that there will be more options for accreditation seals and more information about the type of accreditation and function that the organization is performing. So for example, if an organization is delegated to do behavioral health decisions, starting in 2026, you will be able to see that on NCQA's report card that that organization has an accreditation seal for behavioral health decisions. They may choose to do all 5, they may choose to do 1. And if you're an entity that is interested in accreditation, but maybe you don't do all of these functions, and many of you have noted that you do approvals and recommendations only, that will become available to you in 2026. As I said, there's strong alignment with health plan accreditation. We want to encourage efficient and effective automatic credit transfer between entities. And we know that health plans really value when the accreditation function is performed by an NCQA accredited entity. Another exciting update is our Managed Behavioral Healthcare Accreditation, or MBHO, program. The program covers over 30 organizations, but the number of covered lives is actually exceeds 160 million. So there's a lot of opportunity to make a significant difference for a lot of individuals in the United States with the updates that we're proposing here. For those of you who are familiar with the program, you will notice here that we are introducing a set of standard categories that feel similar to health plan accreditation. You will have a quality management and improvement standards category. There are changes there in terms of expectations, and we're streamlining requirements and sharpen the focus on moving organizations towards standardized measurement of QI activities. There are a number of elements that will be retired in favor of moving to more standardized measurement and using HEDIS measures, for example. Population health management is just as important in the behavioral health space as it is for clinical. And you will see that there's a population health management category of standards that consists of what we already have in terms of complex case management. But there's in general an opportunity here to look at the entire population and segment it and discover what programs and opportunities might be best. Network management is without a doubt a critical component of behavioral health. And that category of standards will consist of what is already available in NBHO, along with some new requirements. The updates that I just spoke about in health plan and accreditation will apply to NBHO. Credentialing, which was recently updated, will not have any updates. And member experience is a new category consisting of existing requirements and some movement, but nothing significant. And again, we are highlighting here the strong alignment between health plan accreditation and MBHO, so that you can continue to experience automatic credit by pursuing and delegating to NCQA accredited entities. Okay. And next, we have long-term services and supports distinction. I think the presentation is eager to move to the next slide, and I'm trying to come back. Okay, here we go. For LTSS distinction, there are currently over 50 organizations, health plans that pursue this option, and 10 states require use this program. There's increased interest from states in terms of measurement, and these are the 4 HEDIS measures that have been optional for reporting for any organization. And NCQA's Committee on Performance Measurement approved the measures for public reporting beginning HEDIS measurement year 2024. So what we are recommending in Health Plan 2026 is that these measures will become required for reporting in June 2028, so ample time, for surveys on or after July 1 of 2027. The data will not be reported on NCQA's report card at this time. It will be available in Quality Compass. And we know organizations value having benchmarks and thresholds and being able to compare their performance to others. And so having more of that data will allow for more robust benchmarks and thresholds. And next, we have our patient-centered medical home PCMH recognition program. First released in 2008, recognizing close to 10,000 practices and over 54,000 clinicians across the country. We are proposing a number of updates for this standards year. You will notice virtual primary care standards included in these updates. They're part of the elective criteria for PCMH. There is a concerted effort to align and enhance alignment between NCQA's health plan accreditation and PCMH, because we really see the importance and want to emphasize the need for payer-provider collaboration and engagement. There are changes around the cadence thresholds to promote integrity and ongoing transformation. And along with adding, we're also subtracting their recommendation to retire 9 criteria that have become standard practice and that NCQA feels are no longer needed to be reviewed in our surveys. And last but not least, NCQA recognizes that artificial intelligence is widely used in healthcare, and that many frameworks provide guidance on its safety and ethical use. But there is a gap in measuring and evaluating how organizations use AI, how they apply AI principles, if the AI is used effectively and monitored responsibly. The set of questions we have offered in our public comment materials is to guide the next steps in how NCQA may pursue the evaluation of use of AI across our programs. We hope that you have the time and energy to provide us with answers to these questions. We'll continue to ask in other venues, but we very much appreciate any feedback that you can provide during our public comment period. And now to the timeline. This is a very high level timeline, and we can provide more detail during the Q&A. But as I said, we will hold a 1-month public comment period. Once that closes on March 25th, our teams are going to read everything that you submitted. We will be refining our recommendations based on feedback that we have gathered during this public comment period. All of the recommendations are reviewed by our committees and approved by those committees with additional feedback. NCQA's Board of Directors approves final program updates in June, and you can expect to see in July Health Plan 2026 standards and guidelines and in IRT, our survey tool, for those of you not familiar with what IRT is, accreditation 2026, and for PCMH, you will have the standards and guidelines, but not the survey tool in July. Now, moving on to November, MBHO 2026 standards and guidelines will be released in IRT, and PCMH recognition 2026 will be released in QPAS or in the survey tool. And then organizations starting in 2026 for PCMH, those surveys for the 2026 guidelines will begin if you have a scheduled survey. And for those organizations pursuing health plan, MBHO or accreditation, those surveys with the updated standards will begin on or after July 1. And now onto the technical side of how to participate. There's a set of documents once you go on our public comment website that we encourage you to read. There's typically, for most of these, there's an overview memo, and the overview memo will provide you with an executive summary of the updates. We think that memo can be used in your conversations within your organization to highlight what is changing, to be able to explain what NCQA, the intent of what NCQA is trying to do with the standards updates. Most of these documents include a crosswalk. The crosswalk will state the future state of the program, how the elements are organized relative to, for example, how they are currently in the 2025 guidelines. That way you can see, for example, in MBHO, there's quite a bit of movement. Similarly to accreditation, a lot of elements are changing places and numbering and names. And we hope that these crosswalks help you, track what is changing and then allow you, when you go to comment, to select the right element for comment. There's also the marked up standards what we call marked up standards that I mentioned earlier. When you open that document, we know it's a long document. What we are trying to do for you is to highlight what has changed by underlining or striking through all of the changes. And that hopefully will allow you to zero in on what is net new and what will be retired moving forward as a recommendation. So once you review the documents, if you do not have an account, we encourage you to set up an account on My NCQA, because even if you're not participating in public comment, you may want to submit a comment in our policy clarification system. But once you set up that account, you will see that there are multiple things you can take advantage of in that account. And public comments is one of them. So in this case, you will click on public comment. You will then in step 4, blue box, add a comment. And I'm advancing, trying to. There will be a drop down. In the beginning of the webinar, I mentioned to you all of the things that are up for public comment. Yes, there's also a HEDIS public comment taking place at the same time. And we have all of the public comments that I just walked you through. So select the program that applies to you. You do not have to submit feedback across 3 programs. If you're a customer of Health Plan Accreditation, you can answer the questions that are listed in Health Plan Accreditation, and our teams in the background will do their best to align all updates. Like I said, to ensure automatic credit, you do not have to comment and answer a million questions. And once you select the program, you have quite a bit of space to provide your narrative, your recommendations. If you do not support something, please tell us why. Tell us, the more detail you tell us, the better. If you support with recommendations, tell us what your recommendation is. And if you support, you can also tell us why you like it if you have time. And once you've done all of that, you can submit. We have also included on our public comment website a list of all questions. This was a request that was made last year by several of you who are seasoned public comment responders, and we heard you loud and clear. You can use that document and gather your feedback and then copy and paste in this system. We appreciate you doing that and taking the time. We know this is not, this is not easy. And before we end and turn to Q&A, I want to encourage you to subscribe to our newsletter. You can scan the QR code easily as soon as you get these slides or while I talk. We have really interesting news from state and federal initiatives to HEDIS announcements and, of course, public comment, reminders that we're starting, that we're closing, and webinar and events. And lastly, we love seeing you in person whenever possible. And we have 2 opportunities to engage with you in person on April 7 and 8 at NCQA's Health Quality Forum, which will be in Baltimore. You can register now for that event. It's approaching quickly. And also the Health Innovation Summit, which draws hundreds of participants across the country. This year, it's taking place October 13th through the 15th in San Diego. And we hope you save the date. The registration will open soon, and we hope to see you there. And at this time, I am going to turn slightly to my right to take a look at the questions that have come through and entertain some live Q&A. Let's see. If I could ask my team to jump in and maybe highlight the first question we want to start with. Okay, and there's
Yes. Oh, we
of
do have one,
things.
but if you
Kim, your Teams chat is open
oh,
in the screen. Yep. I think you have to, yep, there you
there
go.
we go. We were trying to make this seamless for everyone and send the questions over to you directly that way. But the question that was in the Teams chat was, let me move that over, was one second. A general question for practices and transformation across 2025 through 2026, will they be required to use the 2026 standards and guidelines to finish the process?
In general, it's all dependent on your survey date. And so I think this is a good question. It really depends on your upcoming survey date. So I encourage the organization that asked that question to submit that in PCS with their survey date, and we will respond that way.
And then another question has come in around public comment, and this question has come in before in other forums. Are other organizations' comments publicly available?
They're not. NCQA gathers all of the feedback and looks at all the feedback collectively, but historically, we have not published feedback across all. What we did last year is we had a credentialing closeout webinar where we shared with you general feedback that we heard and how NCQA decided to implement, what NCQA decided to implement, but we do not publish all comments.
Thank you. Another question in general for public comment. Is it preferred for organizations to consolidate public comment responses or to have as many as possible responses come through?
It's helpful to hear from the particular organization. So for example, if you are a health plan with multiple lines of business in multiple states, we see when the comment repeats itself, and we recognize that entities will do that because what may be the answer for somebody in Michigan may be the same in Florida if you're from the same health plan. But generally speaking, it is helpful to see nuanced feedback, especially if there's differences, and combined feedback sometimes makes it hard to process. Because we anticipate that depending on where you are, perhaps geographically, or what challenges your population has, we anticipate some kind of nuanced feedback.
And then another question, can comments be submitted at the topic level rather than at the element or factor level?
We no, because the way it's set up specifically to go down to the element and factor is so that we can actually be clear on your feedback and categorize it appropriately. And we do want to hear your feedback in general if that's challenging and how else you would prefer. But for this year, you do have to go through all of the selection and be specific on what element and factor you're providing feedback.
And then another general question, is there a particular format, meaning Word or Excel, that we should use if we want to upload our comments?
At this time, you're not able to upload comments into our public comment database. What might make it easier for you to gather the comment is to use our Q&A, our question document, and gather your feedback and then copy and paste into our system. And we're looking for ways to enable more efficient public comment intake process. So I imagine that's part of the context behind that question, but at this time, we're not able to take an upload.
Thank you. And then another interesting question, does NCQA align with CMS requirements or new requirements? Some examples here are FHIR, APIs, etc.
We do, to the degree where it is appropriate. You will notice in the standards that there are some things that are aligning with NCQA, with CMS, and that's for a reason, because Um, we do want to encourage organizations to get aligned. And our programs obviously deliver more value when we're doing something together with states and the federal government where appropriate. But we also take a look at what how to do this differently so we're adding value. So if there's a specific question, we can take it um offline, but in general, we do try to align where appropriate.
Thank you. And it should be pointed out, one question I will present, but we have had a lot of questions come through the chat around PCMH specifically. And as everyone saw when my chat popped up, we're looking for our teammate who is our expert who's actually at HIMSS right now. So what we will do is follow up directly with those questions. We will have a list of all of your questions that came in for PCMH, and we can follow up accordingly per question. I will bring one up now, Sveta, with you, just in general around PCMH. And it says, I'd like to understand a little bit more why there is no consistency among PCMH reviewers. Everyone seems to ask for different things to satisfy the same components. Can you speak to that a little bit?
Um, we I apologize, and I'm sorry that your experience has not yielded consistency in your survey process. I think this is something that we would like to look into. If you could share your information with us, we can drop my email in the chat. Kim, I don't know if I'm able to do that, but we would like to follow up with you and understand better the challenges you're experiencing.
And then I'm just looking through, as I mentioned, we did have a few specific questions around PCMH, LTSS, and HPA, which I know we said we would follow up with after this directly to those who asked the questions. One general question that came in around our public comment, though, is around you mentioned groups that NCQA, industry groups, this is referring to. NCQA is having conversations with regarding comments and public comments. Are you able to share any of those groups with us?
Um, I am not. However, if you have a group that will welcome us and would like to, have a more focused, targeted feedback session, we welcome the opportunity to sit with you.
And I believe let me see, one more has popped up. I'm trying to address all of the general public comment questions, and then as I mentioned, we will take care of the rest individually.
Sure.
Okay, yes, this is very top of mind. This comment just came in. Will there be health equity accreditation changes?
We're in the process of doing that assessment today. For those of you who are current customers of those programs, NCQA has held different webinars to dive deep into what are some of the allowable exceptions given the executive orders. We anticipate making additional announcements as more information becomes available, but this public comment does not address our health equity requirements in health equity accreditation yet. But there will be more guidance available in the coming weeks.
And I'm looking through, so that seems to cover the general public comment questions. And as I mentioned, we will be sending this recording out. Plus, we will also follow up directly with emails to those that we have with your specific questions that have come in around the specific programs.
Well, thank you so much for your time and attention, and we look forward to reading your comments and seeing you at our upcoming conferences.